Okay, right, we'll start then, guys. Throughout the talk, if you've got any questions about what we're talking about immediately, then feel free to pop your questions in the Q&A box. But as we're using the Q&A box as the chat, if you've got any sort of general UCAT questions, which can be saved till the end, just hold fire popping them in the chat because I might miss them. And there's a Q&A sort of section at the end of this talk where I'll try and answer them. And if you do put questions while I'm talking in the Q&A box and I miss them, feel free to re-ask them later because it might have been that I didn't see them. Hopefully you can all hear me now and see my slides. Could someone let me know if they see the slides just move? Hopefully you did. Yeah, brilliant. Thanks, guys. So we're going to be talking a bit about abstract reasoning today. So just a bit of background. So 6Med, as you all should know, it's a company created by medical students for medical students. And our events include these webinars every Sunday, 2 till 3. We've done a couple on UCAT already, and I think there's one more or two more still to come. We offer, more intense UCAT and BMAT support in the form of crash courses, as well as individual tutors, and then also personal statement support, crash courses. And then we offer quite a lot of interview prep nearer the time of interviews. So a little bit about me. I'm currently just finished my 4th year of medical school at the University of Manchester, and my interests, because most people are usually interested in this, are in medical education and then also pediatrics and emergency, although I'm sure I will end up in GP at some point in my life later on. I'm not sure I can hack the emergency life for too long. But yeah, so I'm always finished medical school and I've been teaching UCAT for about 4 years now. So just to start off with, you don't necessarily need to put this in the chat, but just to think about how confident at the moment do you feel about abstract reasoning. If you want to put it in the chat, feel free to, but you don't have to. And we'll some of you will obviously be at different levels. Some of you will have already done some revision and others might not have done any yet. So just how confident are you guys feeling at the moment? Okay, so quite a big spread then. Some of you are saying very confident, some of you not confident at all, so that's fine. So we'll talk a little bit about the background of abstract reasoning to start off with, just to give you an idea of what kind of thing might come up, and why we do abstract reasoning as well. So the sort of statistics that you might be interested in, you have to do 50 questions within 12 minutes, which is very time pressured. It's the most time pressured section in the whole UCAT, which is why it scares people. And when you're actually taking your exam, sort of everything goes out the window that you've practiced and you're just, having to whiz through everything. It goes really fast. Now, that's about 14 seconds per question, which is quite scary in comparison to some of the other sections, but it's worth bearing in mind a lot of the abstract reasoning questions come in sets of 5 or 6, which means you'll be given a pattern and then asked to sort 5 or 6 different shapes into those patterns. So really, once you've figured out the pattern, if you have figured out the pattern, then actually answering the questions go pretty quick. So you can see it more as, a minute to a minute and a half per set, which feels a little bit more reasonable. So what is the point of abstract reasoning and why has UCAT included it? Because it is sort of one of the newer. Decision-making and abstract reasoning were added to the UCAT later on compared to some of the other sections. So why did they add it? Well, it assesses your pattern recognition skills, but also assesses your ability to avoid misleading information. So they try to put patterns into the sets of shapes that might throw you off the actual scent, actually throw you off what you expected to do. And ultimately, this is meant to mirror the skills that you'll use later. in your medical school career, as well as when you actually become a doctor, when you have to analyze data and form diagnosis. So when you're talking to a patient, you have to decide actually what information is useful and what is not useful, and be able to spot patterns. So really it's meant to mirror those skills, but just in the context of using abstract shapes. So it might seem a bit of a random thing, but actually if you think about it, these are useful skills, these reasoning and pattern recognition skills. Although in real life, rarely do you have to make those decisions within 14 seconds. So a bit about the types of questions that you might see when you come to do abstract reasoning. There are sort of these 4 different question types that UCAT's website outline that they might give you, although some are more common than others. So type 1, you're given, by the way, we'll do some of these questions later, so it might become more evident than just talking about them, but just a sort of an outline of these question types. So type 1, you're given 2 sets of shapes, and each set usually has about 6 different shapes or patterns in them. And they're labeled A and B, and then you're given another shape and asked which set it fits into. So it'll either fit into set A or B or neither, and you have to, choose which one. This is the most common question type, and most of your questions will be this type. And this is the type where you'll be given 6 different shapes to fit into it. So you can almost take a little bit more time with the pattern recognition with type 1. So they should be your favorite type, really. Type 2, you're given a series of shapes. So usually you're given 4 different shapes. And then you're given a 5th shape. Well, you're given sort of some options for the 5th shape, and you have to identify which one's the next in the sequence. These ones are usually sort of standalone questions, so you do need to do them within 15 seconds, which is a little bit more pressured, although often they're a little bit more obvious than type 1s. Type 3s, you're presented with a statement about a group of shapes. So it's laid out as you're given a shape, and then it says this shape is to this shape as a 3rd shape is to a 4th shape, and you have to try and figure out what that 4th shape is. Again, we will do some of these questions later, and hopefully it'll make a bit more sense as to what you have to do. Type 4, they are very similar to type 1. So you're presented with sort of 2 sets again, and you just have to figure out which of 4 options fit into set A. So you'll be told, this is set A, which of these 4 shapes also fits into set A. So it's the same idea as type 1, but just laid out slightly differently. So as I said, we'll go through all of these different question types, and hopefully it makes a little bit more sense, but that's really the outline of them. So this may or may not be useful for you, but I thought I'd include it because some people like this kind of thing. So these are some of the common patterns that come up in UCAT, or really sort of the considerations you should think of when you're trying to identify a rule or a pattern in the UCAT. These aren't necessarily that useful because in the time you are given, it is quite hard to go through every single type of pattern that might come up and, figure out which one it is. You just sort of have to practice a lot and get really good at sort of getting a vibe for what the rule or pattern might be. But some people find this kind of thing useful. So it's called the NSPCC rule, and it stands for basically the things you should be looking for. So the N stands for number. So count the shapes, the sides on the shapes, the corners of the shapes, and right angles used to be very popular. The number of right angles used to almost always be related to the pattern, although I think not so much now. I haven't seen that many anymore when I've gone back through questions, but that used to be popular as well. So just count things and see, does the number of any certain thing increase or always stay the same? But that's one thing you can consider. The S stands for size. So think about how size changes. Usually size doesn't stay the same because that's very obvious, but if there are shapes within each other, do they change sizes, swap around? That's something to think about. The P stands for positioning. And again, think about the positioning in terms of to each other, to the different shapes within the pattern that you're given. So for example, is one shape always pointing towards another shape, or is it changing? Does it point to the shape in some situations or away from the shape in some situations? Just think about positioning, and also think about how things move clockwise and anti-clockwise, because that's really common. When a shape moves 90 degrees clockwise, a color might change, for example. So look at the positioning and how things move around the boxes throughout series and sequences. You can look at color, although normally color isn't the main pattern ever seen in the sequences. It's quite often used as a distractor, because obviously if colors are changing, that automatically makes you think, draw your attention to that. So quite often they just put random colors in to distract you, but it's something you might want to consider. And then confirmation, that just means, think about how the shapes are interacting with each other. Do they always cross over on the one straight side of the shape, for example, or does the color of a shape change when it is on a certain side of a different shape? So that's the sort of main thing, is there is rarely just one rule when it comes to the patterns you're given. So there might be multiple rules. So just think, how do the shapes interact with each other? And that should really give you the clue. So I think the easiest way to teach you about how to do these questions is to actually look at some practice questions. Obviously, some of you might have done some before, some of you might not have. So I'm going to give you more time than you probably need to do these questions, although for anyone who wants to do them timed, I will give you a warning after 15 seconds if you want. And then we'll talk through them, and it might be that you see the pattern, it might be that you don't. It doesn't matter at all, because I'll explain to you the patterns after the fact and the correct answers. And it's just about actually understanding how the UCAT think, if you will, if you want to call it that. What kind of thing are they actually going to give you? All the questions bar one are taken from UCAT's question bank. So these are real questions you might get asked in your UCAT. They're very accurate. So this is going to be your first one. And this is set out in the type 1 sort of category. So these are your two sets that you're given on the left-hand side of the screen. And here are four sort of questions you might be asked relating to these two sets. So in theory, you'd have a minute to answer all 4 of these questions, but I'll give you a minute 30 on this one. And I'll let you know when a minute's up, and then I'll let you know when a minute 30 is up. And then we'll go through them. Try to avoid putting your answers in the chat to start with. I will ask you for your answers afterwards. So just take a minute 30. I'll start my clock in a second. And then we'll talk through the answer of this one. So just give it a go. And if you're completely stuck, don't worry. Just, if you can't spot the pattern, see if you can guess and see how close you actually are with that. So I'll give you a minute 30 now, and I'll mute myself and just turn off my camera for that time. So starting now. A minute's up, so another 30 seconds. Okay, so minute 30 is up there. So just to start off with, does anyone think they know what the pattern for these sets are? And if you do think you know, pop it in the chat. Yeah, okay, well done. I've seen at least 3 people say the right pattern. If you didn't get the pattern, don't worry. Really, that was quite a long time for an abstract reasoning question that I gave you. So sort of in the real one, you know, you would probably have to guess. So even just practicing guessing if you really can't figure out the pattern is still good practice, really, because your instinct will get better. And I did try to choose a relatively easy one for the start. The rest of the questions after this one do get more complex patterns, but I just didn't want to scare you too much to start off with. But this one is all the shapes in set A have curved edges and all the ones in set B have straight edges. And when you know that that's the pattern, it makes answering these questions really easy. You know, sort of fitting these other shapes into the pattern's quite easy because that's quite a nice obvious pattern. So if you've taken, for example, 30 seconds to come up with that pattern, it should really only take you, you know, a couple of seconds to do each one of these, which is why in these questions where you're given multiple to fit with each set, you can take a little longer for the pattern recognition. So the first one, set A, both the shapes in this top left-hand corner are curved, so obviously fit in set A. The top right-hand corner fit with neither because they have both straight and curved edges. Sometimes people get a bit scared of putting neither, especially if you can't see the pattern, but you know, it does come up. And then this one, obviously all straight edges, so set B, and then this one's set A because even though it's a bit of a strange shape, it still has just curved edges. So hopefully that one makes sense. Just flick through the chat in case anyone has any burning questions about that one. But everyone hopefully did okay on that one, I think, from what I can see. But yeah, in this case, colors are distractor and types of shape really are just a distractor. It's just those edges. But well done for anyone who saw that pattern. Yeah, hopefully that one makes a lot of sense, and hopefully you've seen what type A questions will look like. They will look all the same as this, and this will make up a majority of your abstract reasoning. So personally, just raise your hand because you can't unmute yourself. Just pop your question in the chat and I'll keep an eye out for it. Okay, so that's type 1 questions done. The patterns will vary obviously, but they'll all sort of be along the same lines of that. So we'll do type 2. So this is a type 2 question, which is those sequences that I told you about. So I apologize for any like little red marks on the images. That was my own fault when I was trying to copy and paste these questions into the PowerPoint. So ignore the red marks, just look at the black and white. So this is a sequence that you've been given, a sequence of 4 shapes. And the question is, which is the next shape in the sequence? So I'll give you, you'd have 15 seconds to do this one, but I'm going to give you a minute again, just so that you can try and spot the pattern. But I will tell you when 15 seconds is up so that you get a feel for how long you'd actually have. But yeah, so you're looking for the next sequence, the next shape in the sequence, sorry. So I'll start the timer now. Sorry, 15 seconds is up. Okay, a minute is up. So pop your answers in the chat again. And if anyone's seen the pattern, pop what you think the pattern might be in the chat. Okay, so quite a mix of answers for that one. But anyone can guess what the pattern is. It is a slightly more complicated pattern, this one. Okay, so everyone sort of kind of picked up on what the pattern is. It is to do with the pattern rotating. So I've got the UCAT website's explanation in front of me. So they say the entire pattern turns 90 degrees clockwise for each, throughout the sequence. The circles always stay the same color, but as throughout the rotations, the squares will alternate between black and white as they rotate. So hopefully you can see that. So each shape is a rotation 90 degrees clockwise, and then where the black square should be, it'll turn to a white square, and where the white square will be, it'll turn to a black square each time around. So hopefully that makes sense for that one. Most of you got that it was a rotation clockwise. Really, you don't necessarily need to know the rule in as much detail, for example, as I just said. As long as you've kind of gathered right, it's clockwise, so certain answers won't be viable, and you get a rough feel for what the pattern is, you should be okay to take like an educated guess. And in this case, the answer is C because of that. So hopefully that makes sense. The answer is C. I just asked. So yeah, hopefully that pattern makes sense. This is a very common type of pattern where everything rotates, and then usually one thing sort of changes. But yeah, hopefully that one makes sense, and hopefully most of you, I saw quite a lot of C's in the chat, so hopefully a lot of you understood that one. So this is another one of the same idea. I thought this was quite useful to see because I remember a lot of people struggled with this kind of question. Again, please ignore the red dots. That's just where I copied and pasted and my computer left a mark for some reason. But exactly the same as the one we've just done, but obviously a different rule and pattern. So I will give you another minute and then we'll talk through this one. Okay, so starting now. Sorry, I forgot to say when 15 seconds was up. We're about 30 seconds now. Right, minutes up. Okay, I've seen someone got the pattern right. So a lot of people guessed A for this one. That's the right answer. Again, sort of arguably an easier pattern to spot because it's a bit more straightforward. There's not like loads of interaction between the shapes. I mean, any pattern with fewer shapes in the box is obviously easier. But a lot of people guessed A, which is the correct answer. So well done, anyone who said that. In terms of what this pattern is, most of you are pretty much correct. Although some of you are a bit off. This one's a bit, the idea is that the arrow is moving around from north to northeast to east to southeast. So it's the arrow is moving clockwise through the box, and there is always a spot whenever the arrow is pointing towards a corner. So if the arrow is north, west, east, or south, there'll be no spot. But when it's on sort of, northeast or southeast, southwest, northwest, there will be a spot in the box, which is why A is the correct answer. Although those of you who guessed that the spot would be there in alternate boxes, you are technically right, even though the rule says that that's not necessarily correct, but it would work out that that is the case anyway, so you would get the right answer, which is absolutely fine. So I hope that makes sense, that one. So it doesn't really matter which way you want to look at it, but the way UCAT said the rule was that if the arrow is pointing towards a corner, then there would be a spot. But if you want to think of it any other way that would have got you the correct answer, that's fine as well. So hopefully a lot of you saw the pattern in that one, or at least got the correct answer. So we'll do some type 3 questions next. So I will show you what they look like. I think there might be only one of these type. I can't remember whether I put 1 or 2 in. But this is what the type 3 questions will look like. You'll only have a couple of these in your exam, but you're given 3 shapes and you're trying to find the 4th shape. So you look at the top left corner and the statement is that shape is to the one in the top right corner, as the bottom corner is to, and then you're trying to find the answer to that statement and make that statement correct. So I'll give you, so you would have 15 seconds for these type of questions again, but I will give you a minute just to see if you can spot what the rule is for this one. So starting in 1 second, let me just get my stopwatch up. So starting now, and I'll tell you when 15 seconds is up. So 15 seconds is up. Okay, 1 minute's up. So if you just put your answers in the chat again. Okay, people saying C. Any ideas what the rule might be or the rules might be for this one? Anyone got any idea about the rule for this one? Or how they came to figure out C? Not sure, just guessed. Fine, that's no problem. Okay. Okay, so there's 2 people who have guessed the rules I've seen so far, and you are sort of three guesses, 4 guesses. You're all kind of sort of on the right track. So the answer is C, so well done anyone who said C. Again, I have the spiel from UCAT about the answer to this question or what the rule is. So it's quite long-winded, so I'll read it out to you. But in each starting shape, you have 2 large shapes and one is within another one. So you have an outermost large shape and an innermost large shape. So in the top left-hand corner, that's a big circle and a big square. And then within the innermost big shape, so inside the square, there's 3 circles. And then basically everything sort of flips so that the small shape goes to be on the outside of the 3 small shapes turn to be on the outside, and then the larger shape flips to be on the inside. So the big circle goes to be inside the square and the little circles move to be outside of the square. And then they each of the little shapes all move anti-clockwise by 1 place, which is why the black circle moves to the bottom. And then I believe the outermost shape just changes color. I think that's the rule. And that's why you get C. If you look at this and think, oh, I would never have guessed those rules because there's so many of them, you can even just think that you can, see that in this first shape here and the second shape here, you do have all the same shapes, even though they're different sizes and different colors. So you can see, there's 4 circles in a square. So you can assume that when you look at these options that you're given, that you are still going to have 2 squares and 3 triangles in the answer. And that should at least mean you can strike some of the incorrect answers out, which improves your chance of guessing correctly. So even if you see like parts of the pattern, so for example, if you did see that the shapes were moving outwards or inwards or however you want to see the changes in the sizes, even if you just see that aspect of the pattern, it increases your chance of getting the right answer anyway. So if you are struggling to get what the full patterns are, don't worry, because you still should be able to make educated guesses based on the information that you can pick up anyway. So hopefully that one makes sense. This is the only one of question 3 that I have. I've double checked. But yeah, so that's the layout of those question 3s. So hopefully that one made sense, at least a little bit. And we'll do one of question 4 as well, just so you get a feel for what question 4s are like. And you'll see, this is the only one I didn't get off UCAT because for some reason UCAT's website didn't have very many of these types of questions. But you can see how similar it is to question 1. And I'll give you a minute to do this one again. I'll start my stopwatch. So starting now, you'll have a minute. So that was just over a minute. So if you pop your answers in the chat, and if you want to have a guess at what the pattern is, pop that in the chat too. So sort of split between A and D by the looks of things. Any idea what the pattern is? Any idea what the pattern might be? This didn't come from the UCAT website, as I mentioned, but this is a very sort of UCAT kind of pattern that would come up. Okay, no one's telling me what the pattern is, so that might mean you don't know. Same shading and in a this shade in as clockwise. Okay, so someone, I think, I'm not 100% sure how you've worded it, whether it's correct, but it sounds, on the right lines. So I'm going to tell you what it is. So the answer is A. And the first thing to think about with these types of questions, these question fours, first read the question. It says which shape belongs in set A, so you only need to be looking at set A and not set B. Don't get thrown by that, because that's just sort of simple reading of the question. So the rule in this one is you can see this sort of pie-shaped shape. When it points towards the moon, then the framing of the box, the little like picture frame looking things on the side, will match the color of the moon on the right side of the pie, if you're sort of sitting at the pie looking at the moon. And then if it points away from the moon, then the color will match the moon on the left side of the pie, if that makes sense. That's the left side of the pie, sorry, I don't know if I said that. So that's a little sort of complicated to say out loud, but hopefully that makes sense. So it's just when the point is pointing towards the moon, then the color's on one side. If it points away, it's on the other side, and that's just the rule of it, really. So hopefully that rule makes sense. It's quite hard to actually put into words. So the color of the crescent is never white. Yeah, so the color of the crescent is never white in these, because there will always be one frame that's white. So hopefully that one made sense. But at least you can understand how question type 4 is laid out. You can see it's very similar to the first type of questions, really. So that's all the practice questions we've got. So I'll talk through some top tips, then we'll do some questions if you've got any. So be quick when it comes to your exam. Like I said, when you have the adrenaline running through you and you're actually taking the exam, 15 seconds really doesn't feel like anything at all. And when I was practicing for my abstract reasoning many years ago, I often sat with like a list of very common patterns, like a really long list of common patterns, and trying and figure out what the pattern is. But it would take so long, and then when you actually get into the exam, you don't really have time to do that. So just remember to be quick, because you increase your chance of getting a high score if you complete all the questions. If there's some questions you don't get onto, then you're obviously going to get 0 marks on those. So just make sure you're going quick enough to answer all the questions. Use instinct. It's absolutely fine to do this. Even when you get into medical school and then become a doctor, you do have like gut instincts on things where you have to sort information, and people might be lying to you, for example, and you have to decide, like, just based on instinct. Sometimes you know things and you need to trust your instinct. It's like a useful skill to have, where if you're talking to a patient, you're thinking, oh, something's not quite right here, or this actually does feel like something it doesn't necessarily appear to be. So don't be scared of using your instinct. And sometimes if you're going through quick and you're running out of time, you'll just look at the pattern and you just have a gut instinct for one that just feels like it fits in, and it's absolutely okay to use that gut instinct. I know people get scared, like clever people get scared of using that instinct. So the more you practice, the more that instinct will kick in, and you'll be able to see whether something feels like it would fit in or not. If it's a set of questions where it's the same pattern for multiple questions, then don't be scared to take 30 seconds to try and identify the pattern, and then answer the questions. For any of you who identified the pattern in the first one we did, you might have seen that once you got the pattern, how quick it was to actually answer the questions. So make sure you leave enough time for the questions, but don't be scared to sort of reorganize your time so that to sort of optimize it. If you get stuck and you're really not seeing a pattern, don't dwell on it too long and move on to one where you might actually see the pattern. But always make sure you take a guess or use your instinct, because leaving a question blank is an automatic 0 marks on that question. So yeah, and it's just the same with all sort of application for medicine, whether it's interviews or UCAT or BMAT or whatever, and same when you get into medical school exams. If you don't know the answer to a question, you just need to move on and try and forget that it happened, because if you start getting stressed, it will impact the rest of your performance on the exam. So always take a guess and just move on if you're really stuck, and don't keep trying to think back to it. And then if you finish early, which usually doesn't happen in abstract reasoning, but if for some reason you do, you can always go back and have flagged a question and you can go back and give it another go. But don't, make sure you always put a guess, because don't rely on that in abstract reasoning because it's so quick. And then in terms of top tips for revision for abstract reasoning, maybe if you've got a long time before your UCAT, maybe you've got a few weeks or a couple of months, then start off by getting a question bank. There's like 200 questions on UCAT's question bank for abstract reasoning, and just take your time to go through them and try and pick up on patterns, and don't necessarily do it in a timed manner, but then nearer your exam, make sure you're doing mock tests and giving yourself the amount of time and amount of questions that you will actually have for the real thing. So start off with actually practicing the pattern recognition, but then move towards actually how it will be in the exam, 2 weeks, 3 weeks before your actual exam. And just do little and often with this one, because it's not like, biology where you can sit with a textbook and learn all the answers. You can't do that. It's about getting a feel for the types of questions, the types of answer that UCAT will expect you to come up with, basically. So it's up to you whether you put this in the chat again, but think about how confident do you feel about abstract reasoning now. I suspect some of you might not have got all of the rules and might be feeling a little defeated, and I just encourage you not to feel like that. Trust me, I wasn't good at abstract reasoning. It wasn't my favorite section, but I did absolutely fine in my exam because I learned how to trust my gut and learn how to automatically rule out some answers to increase my chance of getting the correct one. And if you practice under time conditions, you'll be absolutely fine when it comes to the real thing. And just don't get bogged down. If you can't figure out what the rule is, practice that guessing technique, and you'll just slowly get better. It's also really important, like none of you now will be able to get 100% on abstract reasoning. You need to go away and practice those questions, but hopefully now you understand the kind of rules that UCAT will be expecting you to pick up on, and hopefully now you understand the question types at least a little bit. So basically, I hope you've got a good foundation. Okay, yeah, so hopefully you've got a good foundation now. My references were there. My only references, by the way, that I used was this website, which I think you have to pay for their question bank, but they had some example questions, and then UCAT's website is absolutely brilliant. It breaks down timings and everything. It has specific like top tips for each section, candidate advice, and it has mock exams for UCAT, which are set up in exactly the same way the actual UCAT test is like done. There's question banks. The question banks are relatively small, so you might need to get a subscription, for example, from SixMed do one, and multiple other websites do their own question banks. So it might be that you use those and then use UCAT's nearer the time of your exam, but they're really, really good, and UCAT's questions are all completely free, so definitely use them. So I'll answer any questions you've got now. I know earlier there was some questions, but I don't think I'm going to find them within the 140 things that have been said in this Q&A thing. So if you could re-put them in the chat if you still need them answering, and then I will try and answer them. So someone said, does SixMed or any other website have lists of patterns for abstract reasoning? So they definitely do, because when I was not SixMed but other websites definitely do, because when I was revising for mine, I definitely wrote out lists of patterns, but it's not necessarily recommended as the best like way to revise, like memorizing the types of patterns that might come up, because there's no way of going through every single type of pattern in 14 seconds. So if you're really struggling, then do lots of practice questions, and the more you do, the more you'll notice common rules that are coming up. But if you search lists of patterns for abstract reasoning, they will come up. Someone will have made some. So, but I don't necessarily recommend using them. They weren't useful for me when it came to actually sitting my exam. But if you feel like you need more background information for common patterns, then you will be able to find them if you Google that. Also, if any of you need to go and are not interested in the Q&A, feel free to go now. And I hope this was useful for you. If you want to stay and watch the Q&A, that's fine as well. Thanks so much for the lesson. Can I just ask, is it true that most of the patterns which come up on the exam are from the patterns shown on the official UCAT practice and mock questions? So yeah, so the way UCAT works is it's a big question bank. It's also the same way that medical school exams work. They have massive question banks and they randomly choose questions for each individual person from this question bank. So their mock tests and question banks, I think, are from older exams, and they've removed them from their like current question bank, but they were previously used on UCAT papers. So the patterns on UCAT's actual website will very closely mirror what will come up in your actual exam, because they have been on UCAT's before. Also, just like a note as well, UCAT used to be called UKCAT. So if you're looking for a book or a question bank and you come across one that says like question bank for UKCAT, then it will be exactly the same questions, it's just a different name. But it changed a few years ago, so you might get it cheaper because people want ones that say UCAT instead of UKCAT, but it will be exactly the same type of questions for abstract reasoning. But some of them won't include decision-making questions, just because that was a very new addition to the UCAT. When can I see the other webinars on other sections? Are they recorded? So the ones that have already been have been recorded and should be on SixMed's website. If you can't find them, then email SixMed's email address, which is on the SixMed website, something like info@sixmed.co.uk, and ask for them and they can send them to you. What was my UCAT score? It was somewhere around, let me figure out. It was somewhere around 2,920. I got an average of about 730. And then band 2 in SJT. So I did okay. And then any other free resources for UCAT? I think some of SixMed's are free. And then you should be able to find free ones online. you just have to have a little look. UCAT's website is just the best one. And then if like cost is like a thing for you, then second-hand UCAT books, or if you talk to medical students, some of them will give you their UCAT books for free. You can usually get them quite cheap second-hand. I used a book when it was called something like 5,000 UCAT questions. So I recommend both of those. In real exams, are abstract reasoning questions harder or easier than UCAT website questions? Real exam, they should be exactly the same as the ones on the UCAT website, the same level. It just it does depend. It is a bit of luck of the draw, because I remember when I did my quantitative reasoning, which is the maths kind of section, I was lucky enough to have quite a lot of questions which were shorter. So instead of having like lots of graphs with multiple questions, I had a lot of individual questions, and I ended up doing very well on my quantitative reasoning questions because my strengths just happened to come up in the randomized questions. So in theory, it could be easier or harder depending on what questions you actually get, but the level should, in theory, be about the same. Have my UCAT in 11 days. Should I start doing a mock every day or mini mocks on each topic until a week before, and then do a full mock every day apart from the UCAT day? So it's in theory up to you. I would maybe, if I was in your shoes, I think UCAT's website has a couple of mocks. So I would be tempted to do one mock, either today or tomorrow, identify where your weaknesses are, and then do some question bank questions again, but still do them timed on your weakest subjects to make sure that you strengthen those, and then maybe do another UCAT mock a day before, a couple of days before your actual exam, just so you can like get a feel for what it's going to be like, sort of to get in the mood for it, really. That's probably the easiest thing to do, but don't try and do any on the day of your UCAT. Make sure you're rested, drink plenty, eat plenty before your exam. If I subscribe to UCAT Ninja, would it be good? Some people have said yes, Medify is better though. So some people have answered your question there. They're the people who've used those banks, so I'd listen to them, really. Are quantitative reasoning and decision-making questions the same or very similar to ones on Medify and UCAT's official website? Everyone asked me this about Medify. I never used Medify, so I don't technically know. I've heard Medify's harder, but I don't know if that's true or not. The ones on UCAT's official website will be exactly the same level of difficulty as the ones you're given. So that's why I recommend UCAT so much, because they are real questions from previous UCATs. Is there a set number of type 1, 2, 3, or 4 questions that come up on each exam? So I don't know if there's exactly a set number, although type 1 is the most common and type 4 is also relatively common. The ones where it's like a series of shapes, they are definitely less common, although I don't know if it's an exact number of each one, but type 1 are by far the most common. In the actual exam, because it's online, you're allowed paper to help you draw patterns and rotate them. You get a whiteboard and a pen, or a form of whiteboard and a pen. You're not allowed any scrap paper, and you have to rub off the whiteboard to use it again, obviously. And also you don't get to take a calculator into the exam with you. You're given an on-screen calculator, and that's the only one you can use. It's not really relevant in abstract reasoning, but it is in other sections. Would you advise us to do the official UCAT mocks twice? Yeah, I would, to be honest. I think because of how UCAT is, it's not necessarily like an exam where it's knowledge. It's not like knowledge where you see the same question and will automatically know the answer. So it's more technique, and it's the same with medical school exams. When you come to them, you keep doing the same questions and get better at them because similar ideas will keep coming up. So if you automatically know an answer for a UCAT question, then that's a good thing, because that question in some form might come up again. Do they provide you with a whiteboard and pen? Yes, they should do. You don't have to bring your own. Okay, any more questions from anyone? Or any that I've missed, please feel free to pop them back in the chat. Can you bring in your own pen? I don't think you can. I think you have to use the whiteboard and pen you're given, from what I remember. Although I would say just check your whiteboard and pen as you're about to start, because if there's any issues with it, you want to tell them quickly. You don't want to sort of get into the middle of a section and realize your pen doesn't work or something, but they should also check it, so that shouldn't be an issue really. Any more questions? If not, feel free to leave. I hope today was useful for any of you as well. Any of you are still here. If you don't know the pattern and you're guessing, is it better to guess A and B than C? I don't think with abstract reasoning there is any that are more commonly used. I know with situational judgment test aspect of it, there are, I think A and D are the most common answers for situational judgment. But I think with abstract reasoning, it's pretty uniform with the answers. Thank you everyone who came. Hopefully it was useful for you. When you see an abstract reasoning question, what do you do first? I would just, look at everything as a whole and see if anything jumps out if you as a pattern or something that's obviously not a correct answer. Sometimes you just look at things and go like, oh, well, that's obviously not a correct answer. Immediately strike that one. But yeah, don't automatically go, right now I'm going to count the sides, because sometimes if you just look at things, you might automatically see a pattern. So just take, 2 seconds to just briefly look at everything. And then if you're stuck, try and focus in a little bit more on the pattern. And then if you're really still not getting it, just try and answer the question. Okay, brilliant. Thank you, guys. Any more questions before I end the webinar? If not, feel free to leave. Do you know about biomed pathway? Do you mean sort of doing biomed and then graduate medicine? Or do you mean just how to get into biomed? Yeah, into medicine. So it's quite a common thing if you don't get into medicine first time, people will put for their fifth choice UCAS, they'll put biomed at like their favorite university, for example. Some universities offer transfer into medicine after 1 year of biomed, although it's pretty rare now to see that happening. So that's one option. So I think you have to be in the top 5% or something of your biomed cohort, and then you can transfer to medicine if you want to automatically, because it's sort of similar content in your first year. If not, then after your 3 years of biomed are done, you can apply for medicine, and you can apply for either a graduate or undergraduate degree at that point, because you have a degree. Graduate medicine is really, really competitive. So if you got a first in your biomed and you've done loads of work experience, then you can consider graduate medicine, which is 4 years. If not, you can still apply for undergraduate medicine, which is 5 years. And if you go in as a grad to that, it's a lot less competitive. So they're really your options. It's not harder to get into medicine for graduates of biomed. If you do well, it's just that graduate medicine courses are very competitive because there's not many spaces on them. So you might just have to go through an undergraduate degree and do an extra year. But it's not, I would say it's relatively easy to get on an undergrad medicine course with a degree, especially if you did well. I know a lot of grads on my course, there's loads. They make up probably about 40% of the year group. That's okay. Thank you, everyone. Any more questions before I end the webinar? Okay, I don't think so. Right, well, thank you everyone for coming. And hopefully this was useful for you. Okay, bye-bye everybody.